for a very informative and uplifting session. I invite you all now to take your places back in the audience. And Nadia, please stay, because you'll be moderating the next panel. Ladies and gentlemen, let's look at the elements of our forum. So we have speakers from Kenya, from Lebanon, from the US, from Georgia, Ukraine, Denmark, Italy, the Netherlands, Switzerland, Nigeria, Pakistan, Zimbabwe, Indonesia, and others. And we also have speakers from key international organizations in the food industry, the national and international businesses, and consulting services. We have a great media team as well. So we are hoping that the forum will become a great connecting platform and will result in numerous cooperations and new product developments. Before we begin session one, can I kindly request your support, please? We will be conducting a question poll, and I ask you all to scan the code, the QR code that's displayed on the screen. And once you've scanned the QR code, you'll see a link to the poll on your device. Please tap on it, open the poll, and answer the questions. So which of the following areas do you believe is most critical for building safer, more resilient food systems in Africa? Is it strengthening national food control systems? Is it enhancing regional and international collaboration? Is it promoting food safety education and awareness? Is it investing in science, innovation, and digital tools? Or is it aligning food safety standards with global frameworks? You have 30 seconds to submit your answers. So now it's time for our first forum panel session, which is Global Perspectives. And Nadia, please ask your panelists to take the stage.
Thank you, Jack. I hope you can let me try with another mic. Hello? Okay, I guess that's the one which works. Okay. So before we are all waiting the results of this poll question, let me kindly invite our distinguished panelist of the Global Perspective in Food Safety panel, Dr. Huyam Salih, Director of the Africa Union Inter-Africa Bureau for Animal Resources, Mr. Cornelia Besh, Food Safety Officer at the Food and Agriculture Organization of the United Nations, Ms. Dragika Pajewicz, Deputy Director for the Eastern and South Africa Region Office of the World Food Programme, and Dr. Betty Leniero, Technical Officer in the Department of Nutrition and Food Safety at the World Health Organization. Yes, please.
I do apologize. I think the poll is not working. Okay, we'll try again later. Apologies for that.
Dr. Leniero? Let me also sit in between. Okay, let me do like that. Yes. Jackie, we are fine to start, or we are waiting the results?
The poll is not working.
Oh.
Yeah, sorry about that.
Okay, okay. Okay, then we have more time to talk then, Jackie. Thank you. So before we start our discussion, I want to ask you to be really mindful on timing. I know that it's very interesting, and I know that all of us are very passionate to talk on food safety, but we'll ask you to have around 10 minutes to respond on the questions which I will ask you today. With this, today we will focus on how this strengthen food safety, how to work together to strengthen food safety in Africa. And naturally, this brings us to the Africa Food Safety Strategy, which is a critical framework, and there is a different resources required for effective implementation of the strategy. We'll also reflect on the progress made so far and highlight several key initiatives that are currently underway. For that also, I want to mention that last year we signed Memorandum of Understanding with Africa Union IBAR, which focuses on joint awareness efforts and collaboration and support food safety in Africa continent. With this, I'd like to introduce Ms. Hulam Salih. Dr. Salih is a Sudanese veterinary epidemiologist with more than 20 years of extensive and diversified experience in managing, planning, and leading for livestock development using animal health interventions, disease risk assessment, prevention in livestock value chains, at national and global levels. She has worked in different positions that aims to maintain the One Health status, ensure compliance with international sanitary phytosanitary measures, and expand livestock value chains linking smallholder producers. Thank you very much, Dr. Salih, to be with us. Now, Africa Union IBAR Food Strategic Plan 2024-2028 positions food safety as integral part of public health, trade facilitation, and resilient food system, and especially through strengthening sanitary, phytosanitary framework and engagement with formal market. So what do you see as the most pressing challenges facing food safety in Africa today, and how can this be effectively addressed through regional strategies like FSSA, and what global trade innovations such as digital traceability or One Health or climate smart food systems should African stakeholders prioritize to close the gap?
Good morning, everyone. Thank you so much for the question and for the opportunity to share the African Union position and status on the food safety. First of all, let me start with the challenges for the food safety in Africa. I will start by 4 key pressing challenges that we think they are the main issues. First of all, the informal markets vulnerabilities that we have in the continent. And second, I will mention the regulatory fragmentations across borders, because as African Union, Inter-African Bureau for Animal Resources, we are looking at the continental level. And since we are working through the regional economic communities and the AU member states, we see that more efforts need to be done to harmonize the regulatory frameworks and the SPS standards in the continent. The third one, and it's linked to the climate change, is the deficit in the infrastructure to support food storages and food safety. The fourth one is the concurrent conflicts in the continent that exacerbating the problems that we already have and create new problems that might migrate cross borders. So for us as African Union, we are guided by the food safety strategy for Africa. And this strategy is being implemented through 2 institutions, and the third one is coming. AU IBAR, the one for which I'm a director, is the Inter-African Bureau for Animal Resources. We are working mainly on the sanitary standards and supporting the capacities at member states to ensure that animal health practices, hygiene, slaughterhouses, abattoirs are in place. The second institutions within the African Union is the Inter-African Phytosanitary Council, and they are mainly working for plant health. And I'm very pleased to announce that the Food Safety Agency for Africa has been endorsed, and it is under establishment to ensure the coordination among all institutions in Africa for food safety. This work is also very complicated, considering that 70 to 80% of our food markets and trade are informals, and they are the backbone for Africa food systems. And smallholders farmers, they are the one vulnerables, but the food produced from those small-scale businesses is the most risky food. So within our strategic plan, and our strategic plan is guided by our livestock development strategy for Africa, food safety strategy for Africa, and Prof. Hamadi just mentioned the new CAADP declaration. And this is the first CAADP strategy has the highest involvement of livestock value chains and SPS enforcements across the continent. So this strategy will be start to be implemented from 2026 up to 2035. And currently, AU-IBAR and the other African Union organizations, with support of our partners, we have started to put together smart indicators to be reported by the AU member states so that we can monitor the progress in the implementation of the CAADP at the national level through the biennial review report that we are mentioning. We are working through it every year. Regarding those are the challenges, but we need to speak about the opportunities and the solutions that we are seeing coming. First of all, we need to make sure that our informal markets are priority and key to be targeted, and the global frameworks to be adapted to the African context. And to do that, we need to ensure that we have collaborative governing bodies across the regional economic communities. So we have the right institutions to oversee the implementations of the food safety strategy for Africa. Yeah, thank you.
Thank you, Dr. Salim. And it's good to hear that Africa Food Safety authorities are starting and launched, and we really hope that to see also more and more improvements. Already heard this reduction of foodborne diseases last years. So talking about the collaboration, I want to also bring another part which we really started and collaborated this year nicely, and I hope that we will continue that collaboration. It's IFC, IBAR, AU, IBAR, the Memorandum of Understandings, through which we conducted different type of webinars, and through which we also trained the SPS experts from around 35 countries in Africa. How important is such collaboration with the international organization, and how it helping policymakers or regulators understand global trends, and also global trend impact on national food systems?
Thank you so much. We are very pleased to have this collaboration in place, and we have implemented good webinars through this MOUs that signed. The last webinar has participation from 35 member states in Africa, and this collaboration for me is crucial because we will bring the innovation at the global level, and then the regulatory officials in Africa will be able to see how they can adapt it to the context in their countries, and moreover to think about how to bring more digitalization to the food markets in Africa. The regulatory frameworks are important, but to enforce them, we need to create good practices in the day-to-day activities of our informal markets. And I think the idea of the webinars itself, it's cost effective, because thinking about the training, it's good, it's important, but the webinars will share more awareness among the officials who should also disseminate the same among their networks. But thinking about how to make it sustainable, I think we have good opportunities even to improve this collaboration further. At the African Union, we are so keen to have African Union centers of excellence that can sustainably disseminate the knowledge, the awareness, and the extension, and the training to the AU member states within the regional economic communities. And I think this will be, can be the next step for this collaboration, to see how we can identify African institutions that will be able to disseminate the knowledge within the region. We need to think also about how to introduce the digital certification within the African context for informal markets, because now smartphones are everywhere, and the certification system can be a gradual improvement for the practices within those markets. And I think in the future we need also to think how to bring more innovation at the community level. This is very important, and to think about the climate situation that we are facing now, and bringing more public-private partnership to ensure that more investments along the food value chains are in place in Africa, so that we move from biggest importers for food and to be satisfying and self-reliant for safe food in the continent. I think this is very important, and we need more private sector to be engaged in that, so that we can pull those smallholder and small food businesses, producers, to be connected to big markets and form a sustainable food value chains. Thank you.
Thank you very much, Dr. Salim, and I really hope our continuous collaboration with Africa Union IBER department, with your team, with the different webinars or events, what we already planned is part of our memorandum of understanding. Thank you very much. With this, let me move with the global perspective on food safety, and I'm just looking to Dr. Laniero. She represents a World Health Organization. Mostly some of you know that World Health Organization has global food safety strategy, let me ask our representative of WHO about that, but before that, let me introduce her. Dr. Laniero is a technical officer at World Health Organization in the Department of Nutrition and Food Safety. She provides technical assistance to government and partner on aspects of nutrition and food safety. She brings over 18 years of experience of helping all age of groups of people in the prevention and management all forms of malnutrition and strategies for food safety. Over the years, Betty Strengson at World Health Organization have gained recognition for development of national policies and guidelines addressing different forms of malnutrition and nutrient deficiencies, supporting nutrition response during emergencies and strategies for food safety. Thank you being with us today, Dr. Laniero. So the World Health Organization Global Strategy, which is 2230, calls all members to develop a national roadmap to strengthen their food safety system. We know that Africa has already its own strategy on food safety. So how this Africa Strategy 2236 and World Health Organization's food safety strategy are in line, and how you see, how does this plan to support countries in the journey to implement food safety strategy as World Health Organization? Perhaps you could also share about our IFC's and WHO's joint roadmap development tool, which our team developed jointly with the Global World Health Food Safety team at WHO, as well as upcoming investment case for foodborne disease surveillance, and how this tool can assist in driving national and regional actions on food safety.
Thank you. I hope you can hear me. So first of all, let me congratulate IFC and all the partners for organizing a very important platform discussing all areas to do with food safety and better nutrition. So let me start with the first question that you talked about. How is the WHO global strategy aligned with that has been developed for the African region? The two are actually very much aligned. When they were developing the one for the African region, led by African Union that she's just talked about, the one for WHO at the global level was a reference document, and that guided the rest of the discussions and key actions and priorities that were included in the African strategy. When we look at the two strategies as well, they all have the same vision, the same goal, which is really around ensuring that we have safe and nutritious food for all. So that, in effect, means that once we have the same vision, we are aligned, okay? Then third, we also see that in both strategies, we are talking about the emphasis is around strengthening the food control systems at the national levels. I was really waiting to see what the poll question response was going to be. And hopefully everyone would have chosen the first one, which is around strengthening the food control systems. Now, this particularly brings together key elements that were also mentioned by the previous speakers. The One Health approach, which was mentioned by one of the speakers earlier on. 2, the use of the scientific evidence to guide the decisions, to guide the plans that we are making. And then 3, it also talks about strengthening risk assessments that we need to be able to do as we move forward in strengthening our control systems. Now, very important, and around this is also the aspect of ensuring that as we talk about food safety, as we talk about nutritious food, we are having an oversight on the traditional markets, we are having an oversight on the local markets, such that we are able to promote trade at all levels, whether it's at national level, at regional level, and internationally. So these 3 elements are really emphasized in all these 2 strategies. So alignment comes across. As far as implementation is concerned, when we look at the African strategy, it has a very clear results framework. And that along goes with the monitoring and evaluation. Similarly, for the global, it does have an implementation framework. And in 2024, we had the WHO Committee for Africa meeting. And this is where you have all the ministers of health for each of the countries coming together, and they agreed on a results implementation framework for the WHO global strategy, but specific for the African region. So there is alignment across these 2 strategies, and having the same vision, I think we are all aligned in that aspect as around food safety. I want to come to your second question around some of the ongoing work and collaborations with IFC in terms of how we can then support countries to achieve this goal of ensuring that we have safe food and nutritious food for all the populations. Now, we've had a very good collaboration with IFC. We're developing a national roadmap tool. So this is a tool that is going to really assist countries in being able to, 1, identify the key challenges or the key priorities as far as food safety is concerned. Now, once they're able to use this tool, it will then next help them to prioritize. Following identification of what the challenges are, the tool is also able to help them know how to prioritize which one needs to be addressed first. And then lastly, it will also help them come up with a consequential and a coordinated plan, or what we now call the roadmap. So together in collaboration with IFC, the WHO Secretariat, as well as the Technical Advisory Board on Food Safety, this tool is in its finalization processes and should be made available to all countries. It is a very important tool. As we see in the African country, we still have really big challenges, and a number of countries have not yet finalized or developed their national strategies to implement or to strengthen the implementation of food strategy or food safety. And we know that improving, anything to do with improving or implementation of a strategy really requires the national commitment and it happens at the national level. We may have all the global plans, the regional plans, but the implementation happens at the national level. So this tool will be very important to support the national level development of its roadmap. The last aspect actually that is also very important is that there is an investment case with regards to food safety that we've worked upon. And I think here the bottom line is financial investment is key. We need the finances to be able to implement all that it is that we are talking about. But before we get those finances, people actually need to be convinced, why should I invest my money or the finances into food safety? And WHO and IFC have worked on an investment case, and within this we actually had Kenya participating as one of the 17 countries. So from this investment case, the results are, the analysis is ongoing and the results should be out. I can give you a sneak peek into some of the results that we are seeing. First, we see that one is that in the, first of all, let me tell you about how the investment case was done. It did include some of the parameters from the joint external evaluations, which is what we use in the international health regulations. And that's how the different countries are reporting on their status of food safety. So now we see that for every 1 point increase in the JE score for these countries, we are able to reduce the incidence of foodborne disease by nearly 6.4%. So yes, so if we have small investments as far as food safety is concerned, we are going to see continuous improvement in the JE score, as well as, which eventually translates to reduced foodborne disease across the population. Secondly, we also see that for these 17 countries that were involved in the investment case, about $492 was invested across the 17 countries over a 10-year period. And this is able to avert about 19 million cases of foodborne diseases. And this is equivalent to, as well as about 13,000 deaths. Now, the equivalent of what we would have used to treat the foodborne ill diseases and also what is lost as far as lives is contributing to about, is equivalent to about 23 billion. So this investment case actually justifies why we need to invest as much as possible into aspects on food safety. And we hope that the investment case report that will come out, countries will use this as an advocacy tool across the region. Thank you.
Thank you, Dr. Laniero. And yeah, so we are also proud of our collaboration with WHO. And I want to just highlight here, mention that WHO IFC roadmap development tool was based on IFC Scan Guide, which has been developed like 2 years ago by IFC team. And that was the beginning of our collaboration whenever your Department of Food Safety and Nutrition saw and revised our assessment tool, which looks and assesses the policy and regulations on food safety, food loss and waste, and food fortification. So it's a very interesting tool. If you have never seen this, please download it. It's also on IFC webpage. Let me ask you one last question. So while food safety is essential to protect public health and nutritional quality of food, is also very equally essential, and particularly in addressing malnutrition and like non-communicable disease across the continent. We know the issues of micronutrient deficiencies in the country, in the continent. So from your perspective, knowing that you are food safety and also nutrition specialist, how are food safety and food nutrition interlinked in practice, and how you see that, how it can be put integrated approach on help or ensure that food is not only safe but it's nutritious, and also what's important, accessible for people.
Okay, thank you. Very interesting question. And really brings the different aspects as far as nutritious food and safe food is concerned. So maybe about 3 points here to highlight. One is one that is very common, the aspect of health and disease and the physical things that we see as far as relation. So when you have a very clear example is when we consume unsafe food, what happens? We get a stomach upset, we get diarrhea or something of the sort. And what does that translate to? So you'll either come and say, I have a poor appetite, I don't want to eat. So if that happens continuously, you can see that an individual will actually have reduced intake as far as nutrients is concerned, but also the absorption of these nutrients, even if they eat, will be affected. The end result is malnutrition, which can come in at different levels. During the opening remarks, they did talk about the impact of malnutrition that we are currently seeing, and this is actually quite devastating when you look at the numbers in the African region. So given that as the African region, we contribute to nearly a third of the global foodborne disease, and yet we also have a huge number, more than a third of the children and women who have severe acute malnutrition. So we can see that there is already an interlinkage, and we need to marry the two. As we address food safety, we also make sure the nutritious component is coming in. The other aspect maybe that I would highlight here is the supply chain. The food supply chain, and this is really starting right from the farm all the way to the table. Issues to do with, this can affect the nutritiousness of the food and its safety, both positively or negatively, okay? When we look at the supply chain, I'll give an example of how we are storing the food. So storage of food, for example, when we are drying it, are we able to maintain all the nutrients that are there? When we use the salt as part of the preservation, how is that affecting the nutrient value in the food, and how is it affecting the overall health? When we are talking about, okay, let us reduce salt intake so that we prevent the hypertension, which is an NCD, a non-communicable disease. So as we are thinking through the different aspects of the supply chain, storage, handling, production, all of those will eventually have an impact on how we consume the food, okay? Its actual content, whether it is dried and fermented, all of those have impacts on the nutrient component of the food. The third one that I would like to just highlight here is the consumer behavior. If the population, or if an individual imagines or considers that this food is unsafe, okay, they will not take it. But we know that this food is actually nutritious. So they may develop a behavior of not consuming some foods. So for example, if I give you an example, very common are vegetables or fresh vegetables, okay? People go to different places and they're like, I'm not sure if that is safe for me to eat. Have we experienced that? And you'll find that they may develop that concept or that behavior that if this is not important or it's not safe, I will not consume it. But we all know that the importance of eating the vegetables as far as nutrition is concerned. The other aspect also that usually we need to consider is the aspect of policies and regulations. When we have very stringent policies and regulations as far as food safety is concerned, which is very important to also make the people confident that the food is safe. But if it makes it unaffordable for them, then they will not consume those nutritious foods that we are coming up with. And the end result is we end up going for ultra-processed foods, which eventually circle back to non-communicable diseases. So I think just to respond to your question, those are some of the ways the interlinkages happen. And as we move forward, especially as we look at the regulatory frameworks, the policies, we need to ensure that it looks at safety of the food, but also the nutritious component, and this is across the entire food system. Yes.
Thank you, Dr. Laniero. And I, from the beginning, mentioned that we're all passionate to talk about this topic, and I know that it's not, unfortunately, enough time for everyone to reflect everything what we want. But with this, let me thank you, and let me move to World Food Program. Those work deeply intersect both public sector and private sector efforts to ensure food is safe, also, but is also preserved and also accessible. With this, let me introduce Miss Dragica Pajevic. I hope I'm trying to pronounce right. The Deputy Regional Director for the Eastern and Southern African Regional Office of the United Nations Food Wealth Program, based in Nairobi, Kenya, with nearly 25 years of experience in humanitarian leadership. Dragica has extensive experience in emergency response, supply chain management, regional coordination, and program support across Europe, the Middle East, and Africa. Welcome to this panel, Ms. Pajevic. So given World Food Program presence in the field and logistics capability, what role can the organization play in supporting national level implementation of food safety measures, especially in the continent, considering the variety of the countries' environment and countries' food safety also practices?
Thank you very much. So, as announced, my name is Dragica Pajevic. Yes, 2.5 decades, a little bit more. My bio is not updated, so sorry for that. In World Food Program. Thank you for your question. It's one that can be answered in many, many ways, but for the part of the audience that is not really familiar with who World Food Program is, just to say that we currently have a presence in about 120 countries. And very few of those 120 countries are in the developed, according to the Development Index. Most of the countries where we operate are developing countries, countries that are ridden by conflict, by climate change, poor infrastructure, both in terms of logistics, but also in terms of ensuring safe handling of food, not even to talk about the production. And it was very interesting for me to hear what Dr. Salih mentioned, and it actually came up time and again, that issue of proper handling of the food. Now, how would I like to answer to this question is from the perspective of what is our biggest reputation as World Food Program. We are quite big food handlers, actually, in very, very challenging environments. For example, in 2024, we distributed around 2.5 million tons of food. Not small quantity, given that most of that food is actually distributed in the most inaccessible areas that we could that we could come across, because in areas where markets are functioning, we would rather actually distribute cash either digitally or hard cash, because we also want to promote working of the markets. So those 2.5 million tons really go to the places where often there is no reliable supply of electricity, so keeping the commodities in good condition is a challenge to begin with. And throughout doing that, from the source to the beneficiaries, what we try and do is to actually oversee the state of that food in terms of both safety and its nutritional value or other quality aspects of it. That's not really the end of it, because what we realized over the decades of primarily focusing on a rapid response to the emergencies is that we actually do have a lot more to offer. And we have a lot more to offer precisely because we are present in those environments where most of the problems are actually happening. So what we do, and it started more like how would I say, a sidekick, if I can call it that way, but then it is becoming more and more formalized, and it is actually already at this stage institutionalized. It's in the field of the capacity strengthening. And that capacity strengthening really ranges from a number of things. As we are going more into developing specialized nutritious foods in order to be able to target the most vulnerable parts of the population, we really try and work as much as possible with the local suppliers, with the local producers, with smallholder farmers, and all those players on the markets where the consumption of the products that we are distributing actually is. And we see really a great advantage universally, globally, when it comes to that. For example, how to put it? Some of our biggest producers of precisely specialized nutritious foods, which are considered to be rather complex products, are actually on this continent. One of our bigger suppliers is in Rwanda. We work with those entities that have production lines and their own supply chains in sourcing the inputs, bringing in our expertise, working with them together so that they can come to the point of having a marketable product, and working with other partners to actually ensure the market for them. Lots of webinars, lots of involvements in how to actually tackle what is a big issue in Africa, in my view, that is the post-harvest losses and the post-harvest food management. Quite a lot of work actually being done there. So, yeah, I don't really know how more to answer this without taking up all the time. Just to mention, as a conclusion, we do have globally spread a team of dedicated food safety and quality specialists, and that's one of the things that we put a lot of effort and attention to. Thank you.
Thank you, Ms. Pajevic. We heard about the Africa Food Safety Strategy today, yes, and you might align, or let me ask how you are aligning World Food Programs, operations, and partnerships with the priorities, which is also outlined and mentioned in the Africa Food Safety Strategy 2022-36, and what are the key challenges and opportunities you have identified in contributing to its implementation, Africa Food Safety Strategy's implementation?
Thank you. Let me start with this. When it comes to the Africa's food safety strategy, on one hand, and the WFP's strategic plan on the other hand, the good thing is, which is probably why we are talking, that we are very, very much aligned there. There is a lot of points of alignment. We like to say in WFP something which was mentioned earlier today here: if it's not safe, it's not food. And that's really the first thing to start with. Now, the other question is how that alignment in principle could actually translate into something of tangible value on both ends. Now, you asked me also about the challenges. And I was listening to other speakers as well, and it's not surprising, but it is interesting how aligned we all are when it comes to what the challenges are, and they seem to be just so obvious, I guess. There was a mentioning of a regulatory framework when it comes to food safety and quality. Yes, it's an issue. It's an issue because it stands on the way of the trade, and that can also become a food quality and safety issue, because if it takes, somebody mentioned, 4 months to move something across the border, it does become food quality and safety issue. Harmonizing certain standards across the continent, I would really encourage anyone who is empowered to do that, to move in that direction, and WFP stands with its expertise, albeit limited, to actually try and help with that, or give any suggestions. Again, the post-harvest practices, I think it was Dr. Salih who mentioned the poor or deficit in infrastructure, sorry, to use her words, deficit in infrastructure. Indeed, it is an issue. And it's not only about the infrastructure, it is also about the practices. How can we work together and come to a point where we reduce the post-harvest loss? And it's not only in the physical loss of the commodity, it is in the loss of the safety and quality of the commodity and the high risks that we all have, even myself and all of us as consumers, that some of them can actually escape. All the measures that are put in place and end up on the shelves, not to speak about the unregulated parts of the markets when we talk about the small businesses and so on and so forth. So a lot of points of prospective collaboration.
Thank you, Ms. Pajevic, and it's really interesting how we as a different organization perspective see on the same thing, challenges and also opportunities like similarly, and also how we could all maybe jointly work, and we have different example with World Food Program work in different countries as well, and I hope that we also collaborate in Africa in different directions. You might know that we globally with the World Food Program team work very closely, especially there was different cases in South Asia countries, also in the Central Asia countries, but I really hope that we could bring joint collaboration and joint activities here in Africa as well. With this, let me continue the theme of strategic implementation and multi-agency collaboration aspects and move to FAO, Food and Agriculture Organization of the United Nations. We have today Ms. Carolina Bush. She holds the position of Food Safety Officer in the organization. Her responsibilities include building capacity in food safety, providing technical assistance in food safety and quality to member countries, Prior to her role at FAO, she worked in the private food sector, focusing on research and development, intellectual property management, and the implementation of quality and safety management system for small and medium-sized businesses. Ms. Besh, I want to move to another very interesting topic, which we've mentioned already several times today. It is food loss and waste. Reducing food loss and waste is a key priority for improving the food security, sustainability, especially in Africa, where much of the losses comes from, as it was mentioned several times, from post-harvest, and also at the market level. So from FAO perspective, how can improving food safety standards and practices contribute to reducing food loss and waste across African food systems? And what integrated approaches or initiatives FAO supporting to reduce food loss and waste in Africa?
Thank you very much for that question, and it is great to be here, and thanks very much to the audience to be sitting here. They're still all looking in our direction, so we haven't sent them to sleep. It's very difficult to compete with the opening salvo that we got. So let me start. Thank you very much for this question. Just briefly on standards, why do we have food safety standards? Standards is where we have all agreed, where information from the private sector, from academia, from science comes together and is hosted to explain what criteria we have for food and what practices we have for food that we all have to adhere to make it safe. And so the thing is that the position of FAO, we work, of course, towards and very closely with Codex Alimentarius, but we also consider all of the other organizations out there that in the standard-making business for food, that we do these standards. These standards are created to make food, as our WFP colleague said so correctly, it's for each of us safe. So I would not say that it is about changing the standards and the practices, sort of to dilute it down to the level of those people that cannot comply with it, that actually is the way to go. When we now come to Africa, so there is data, and the thing I think everyone always forgets is how big Africa is. Most of the countries I know and have visited can fit into Africa. We sort of mention Africa, but it is one of the biggest places in the world. So distances are enormous. I would also like to pick up on what Mrs. Saleh had said before, Dr. Saleh, about the scenarios in Africa. Family farms produce roughly 80% of the world's food in value terms. 5 of every 6 farms in the world consist of less than 2 hectares. And in sub-Saharan Africa, small holdings occupy a large share of agricultural land. So, for all of these many, many people who are so important to the food security, to the nutritional stability of the populations here, and also export a lot of produce and commodities into the rest of the world. We all depend on Africa for our foods to a large extent. We have to say that non-compliance with standards is the bottleneck which will prevent these businesses, these small businesses, from able to access markets and grow into businesses that are sustainable, viable, that can actually compete. So that is the thinking that we have. And so what we are doing is, and everybody has said that, we have to work to enable that these smallholders, these small businesses can comply, so that we have the source. So you have the big ones, the medium businesses, they can afford, they have the know-how, they get the support, and they can comply with standards. The small ones, we have to help. And they are innumerable, so we have to be open enough to do it. So what would you say, the standards, we wouldn't change the standards, but we have to give time to these businesses to be able to comply with that. So that is what I would also say to any policymakers that are here. It is not because the EU now has some new standard as a trading partner that you just come down with an axe and say all of the business here have to comply with it. You have to have programs that will have a goal of in 10 years' time, and then you give a nice percentage. I have to leave that to the economists in the room to be able to come up with those calculations, to be able to then comply. So we are working towards compliance so that the food is safe for everybody, so that we are all playing, or that we have a level playing field. And we have, for complying with one of the main standards in food safety, which is the Codex General Principles of Food Hygiene, FAO has created the online toolbox, the GHP and HACCP toolbox for food safety, which provides practical guidance on how to practically implement these standards. And so that is something that, you know, together with the IFT tools, everything is out there. Go and look at these really good guidance materials that enable you to apply and your constituents to apply the basic food safety standards as defined by Codex. And in response to your second question on food loss and waste, I would just like to, and I know lots of people here are doing incredible work on food loss and waste. So FAO, when we have produced something, it is always in partnership. So we're in partnership with African Union, with WHO, WFP, those are our sister organizations. And so we have the technical platform on the measurement and reduction of food loss and waste, which contains the food loss and waste database. And the issue there is that we're all working with models because the data is so incredibly scarce. And so that is where, you know, let's the good work continue to make sure that these models actually represent the reality on the ground. We have that, and then just very briefly, there are normative products that we have, such as the Voluntary Code of Conduct for Food Loss and Waste, which is a framework of actions and guiding principles, which guides how one would address this topic.
Thank you so much. Thank you. And I'm sure the food loss and waste experts sitting in the room using the database of WHO. We will have also a special session related to food loss and waste today, where we also will present IFC-developed food loss and waste climate impact tool, that's how we are calling, which also are based off the data getting from the WHO. Of course, it was developed by IFC and Carbon Trust team. Very informative tool, which is for everyone to download and easy to use. So we will talk on that. But with this, let me continue about the forum's focus. And we started to mentioning about the women's involvement and women's empowerment. So focus on private sector engagement and the vital role of women in building resilient food systems. How can public-private partnerships be of use in enhancing food system outcomes while also advancing women's economic empowerment in agribusiness? How can respond on this question?
So we always speak about public and private, and it's very, very difficult because there are private businesses that are publicly owned, et cetera, when you go sort of into the definitions of all these things. And nobody operating in a country that has rules and regulations, which are most of the countries operating in the food sector, is operating in a void. They should all be adhering to these rules and regulations. Now, where I would say there is a big difference between what we sort of generally call public and generally call private is in the private sector, what you have is the entrepreneurship, which I'm putting ourselves from the, even if we try to be entrepreneurial and understand it, but we are international organizations, that is more of the public sector. That is not our forte, let's say. So we have to team up. We need these partnerships so we can also reach in the private-public partnerships, also with, for example, banks, so that you have investors, so that you can see that you are getting the knowledge from the private sector, that the feedback loop is working, so that we are actually listening and hearing, and we do that. If you go to the field and you start working with food businesses and you really also listen to them, they will come up with incredible solutions of little things that they have changed to comply, to make their food safer, and to understand, and for us to understand what they are doing and what their constraints are to be able to comply with standards is the important part. So this whole feedback loop and having fora like this where you do bring the private sector and the public sector together is really useful. The thing that I would like to speak about is that we have the informal sector that has been mentioned. But I would like to say that many of the players in the informal sector actually pay taxes. So they're not informal. They've been left out of the game that we are playing. So someone has to make sure that, you know, in the food safety standards world, the ones that adhere to standards, that the others that are not adhering to it, let us think differently. And may I bring just one example coming from Switzerland, my country. If you start a food business, you do not need to get certified. You start the food business, the law is such that you fall under the law immediately. The inspectors will come and visit you, and if you are not doing the right thing, they have the authority to close you down. But by default, what this means that anybody who starts a food business is already in the system. And I would like to just put this out here as a thought. I know that Switzerland is one small country in the world, and we do many things wrong, but certain things they work. And, you know, business thrives there. So I'm just throwing this out here as food for thought, if I may. So that's what I would just like to put out there on this thinking.
Thank you, Cornelia. Thanks a lot for the intersection of food safety, food loss, empower of women and strengthen food safety system around the ground, and for the example what you just bring.
May I just add one thing that
Absolutely.
I forgot? The women. And we have data, our gender colleagues at FAO, WHO, everywhere, they keep on saying we have the numbers. The problem is that women are crucial to processing foods, producing foods, and they are often not loud enough, they are often not considered important enough to be taught about food safety standards, complying with good practices on how to produce and process foods. And so any program, until we really make sure that every person, including the women who are operating along the food value chain, has actually got access to this knowledge and has been taught how to apply it, is actually involved, then we can speak of, you know, a good result. So it really, really is crucial to consider women in any work. Thank you.
Thank you very much. And I once again look on the screen and timing, so I guess that's the reason why they put that for us. I of course had the last question to all of you, but let me just leave it for you and think on that. So share one key insight you are taking from today's discussion, but I guess that you will stay with us, that there will be a lot of other discussions as well, and you will have not only one but many takeaways from this event. With this, let me thank you all for your really rich, forward-looking discussion today, and it's a pleasure being the moderator of this amazing panel with you, and I hope that these organizations together could improve food safety not only in Africa but also in another world. Let's try with small part, but we could then go and bring and raise our food safety worldwide. And one thing I want to mention and to remind maybe everyone that safe food, zero waste, better nutrition, it's our path to global well-being. That's what I really love to say and love to mention. Thank you, everyone.